Okay, so let me just go back.
Hi, good morning, good afternoon, and good evening, everyone. My name is Jane Cato-Wallace, and I am the Director of Programs at Promundo, co-hosting this webinar with IPAS and ICRW. Thank you all so much for joining us. I think we're about to start because it is the time, 8 a.m. U.S. Eastern Time. So once again, thank you all for joining us. I'm going to hand it over to my colleague, Catherine Anderson, who's our Chief Science and Technical Officer, to give us a more formal welcome to the webinar. Catherine, over to you.
Thanks so much, Jane. So I'll echo Jane's welcome. We're really pleased to be presenting this webinar jointly with Promundo and ICRW. And I noticed that there was a question about introducing the participants. I don't think we'll be taking the time to introduce the group that's participating at the beginning, although we will be taking questions toward the end, and that can be an opportunity to introduce yourselves and let us know where you're from. But I'm going to start by telling you a little bit about IPAS and about the presenters today. So if my screen isn't quite right, somebody please let me know. IPAS is the only international organization with a singular focus on expanding access to safe, high-quality abortion and contraceptive care. Across Africa, Asia, and Latin America, we work with partners to train abortion providers, connect women with vital information so they can access services, and to advocate for safe, legal abortion. 44,000 women and girls die each year from unsafe abortions, and millions more suffer serious, often permanent injuries. Around the world, our programs and our research strive to improve reproductive health services for women and girls, to increase their access to these services and expand their sexual and reproductive rights, their human rights. IPAS generates new knowledge for the larger reproductive health and rights community, and we also focus on targeted research to understand more about women's needs and wants regarding reproductive health care and how they make decisions about contraception and abortion. Both our research and global evidence suggest that men are frequently involved in some way in both abortion decision-making and care seeking. Male involvement in abortion care may be perceived as negative or positive, both by women and those who provide care. So therefore, IPAS is committed to understanding men's participation in sexual and reproductive health and rights, and to promoting strategies that support women's informed decision-making and access to abortion services. IPAS has also been working with groups of men and young men in many of our country programs to increase access to sexual and reproductive health services, including contraception and comprehensive abortion care. IPAS sensitizes community leaders, healthcare providers, military personnel, and law enforcement on the importance of supporting women's sexual and reproductive choices and speaking out against gender-based violence and abortion criminalization. So that's a little bit about IPAS. Now let me introduce our presenters. Sapna Kedia works as technical specialist with the International Center for Research on Women, ICRW. At ICRW, she coordinates and conducts qualitative research primarily on health and reproductive rights of women. She led the study on male involvement in premarital abortions in Delhi. Sapna also supports the 3D program for women and girls at ICRW, which has at its core the idea of convergence for addressing the multiple needs of women and girls. Sapna holds a master's in political science from Jawaharlal Nehru University, Delhi, India, and a bachelor's in political science from Lady Shri Ram College at Delhi University in India. In addition, Samuel Antebaum will be speaking. He is a senior researcher and evaluation advisor at IPAS Ghana, where he provides technical leadership for research, monitoring, and evaluation efforts. Before joining IPAS, he worked as a research fellow at the Agincourt Population and Health Unit of the University of Witwatersrand, where he provided technical direction to various research projects. He also spent 6 years at the Growth Laboratory, South Africa, providing technical leadership in labor market research and evaluation of social interventions implemented by state departments. He holds a PhD in demography and population studies from the University of Witwatersrand, South Africa. His areas of research interest are reproductive health, migration, and labor markets. And Jane Cotto-Wallace, as she mentioned earlier, is the Director of Programs at Promundo. Her experience centers on program development, training, and research related to engaging men and boys. She played a large role in the development and expansion of the global Men Care campaign and currently trains international partners on implementing Program P, a gender transformative multi-pronged approach to engaging men as caregivers. Jane has co-authored several publications and reports for academic journals, the UN, and NGOs on emerging topics related to men, boys, and gender equality. Jane's previous work experience includes conducting public health research with Columbia University and in gender health on the US-based Gender Matters program and supporting a USAID health policy project in the Latin American region. Jane has a master's degree in public health from Columbia University and speaks Spanish and beginner level Mandarin. So Jane, I'll turn it over to you now.
Great. Thanks so much for that great introduction, Catherine. I'm going to go ahead and share my screen. Okay. So we at Promundo are so happy to co-host this webinar with Ipas, a leading organization working on women's health and reproductive rights, and ICRW, a partner who we've worked with for over 10 years now on masculinities research around the world. So we're just thrilled to be having this webinar and being able to share this really exciting research with you all. The research my colleague Sapna will be presenting on behalf of ICRW was supported by Promundo and the MacArthur Foundation, and we're grateful for their support. As Catherine shared, my name is Jane Cotto-Wallace, and I'm the Director of Programs at Promundo and was the Promundo lead on the research with ICRW South Asia. Can I ask the other presenters to kindly just mute their lines just to avoid any extra background noise? That would be fantastic. Thank you. So before moving ahead to hearing about these two really interesting country studies in India and Ghana, as a group we believed it would be important to make visible our guiding principles in terms of how it guided our research objectives, our analysis, and our conclusions. So at the heart of this research, we aim to, above all, center women's rights and choice, including women's rights to choose if and how their partners are included in their sexual and reproductive health decisions and services. We believe that safe abortion with dignity is every woman's right, and as noted in the recent Lancet Guttmacher Commission report, a key pillar of a comprehensive sexual and reproductive health and rights platform. This includes a woman's right to choose if and how, again, their partners are included in their decision-making and service seeking. So the research presented here aims to complement and affirm existing approaches and inquiry that promote equality, prevent gender-based violence, and improve sexual and reproductive health and rights for women around the world. We also aim to utilize, and you'll see this throughout the presentations, a gender and power lens to understand these different dynamics. Since gender is one among many axes of identity and social discrimination, such as class, education, and so forth, that define and influence individuals, we have to ensure that our analysis of gender is also intersectional. Using a gender and power lens means that we explore these overlapping identities and their respective experiences within these layers. Utilizing such an approach allows for a wider and deeper exploration of individual understanding and social access and encounters with regards to male involvement in premarital abortion. The theory of gender and power, including intersectional feminist theory, examines how rigid constructions of masculinity and femininity in the context of other forms of oppression and marginalization create power imbalances in relationships and drive poor outcomes. Such theoretical framing enables us to better understand how men and women in these heterosexual relationships make decisions around premarital abortion. in India, for example. And then another guiding principle is that we aim to take a positive approach to men's engagement. We believe that it's important to support men to be caring, gender equitable, and active in their health and relationships, and their activism. We at Promundo conduct our research searching for entry points to invite men to be agents of positive change in their lives and their relationships and communities, as well as how to be advocates for gender equality and sexual and reproductive health and rights more broadly. We believe that engaging men in sexual and reproductive health and rights contributes to achieving gender equity, meaning fairness and justice in the distribution of resources, responsibilities, and benefits available to everyone. And then finally, we aim to utilize an ecological framework to understand the dynamic environment in which these decisions, often very difficult decisions, are made. It helps us to build a comprehensive and dynamic argument from multiple but also interrelated levels of the landscape of abortion decision making. So with that framing in mind, I'd like to hand it over to my colleague Sapna Kedia, who will talk to us about her research findings on premarital abortion decision making in India. Sapna, over to you.
Hi, Jane. Thank you. I'll just share my screen. Hi, everybody. I'm Sapna Kedia, and I work with the International Center for Research on Women. Thanks, Catherine and Jane, for the introduction and setting the context for the next half an hour to 45 minutes. Before I begin this presentation on male involvement in premarital abortions in New Delhi, I'd like to give a big shout out to the research team. I'd like to thank Priyanka Banerjee, Amrita Nandi, and Annie Vincent, who have been researchers on this study and who've made this study a lot of fun. I'd also like to thank Jane and Ravi for their guidance and for their feedback and review throughout the process. So this study, male involvement in premarital abortion, was conducted over the last 6 months in Delhi. And what we tried to do with this study is address some existing gaps on research on abortion. And the reason why we sort of focused on male involvement and premarital abortions is because around a couple of decades ago, male involvement was established as a global priority to look, to also work on sexual and reproductive health needs of women. Since then, there has been a lot of research on men and engaging men around sexual and reproductive health needs of women, but research on their male involvement in abortion is limited. And usually this is from women's perspective. There is very little evidence on what men think, what they feel, and what they do. So male involvement in abortion becomes crucial, not just for the individual woman who's in the situation, but also largely in terms of broadening women's access to safe abortion, and also in terms of gender equality, where we are looking at creating equal relationships before and after pregnancy and during pregnancy. So male involvement during abortion, pre and post, is very crucial. In the context of a country like India, premarital abortions are highly stigmatized. So in that situation, men's role probably becomes more crucial, and we'll see that as I proceed. So given this gap in existing research, we thought that we'll do a small exploratory study to find out what do young unmarried men in India, in New Delhi, think about premarital pregnancies. What do they think about a premarital abortion? What do they do if they are in a situation of premarital abortion? And by speaking to them, have we been able to identify areas for further inquiry? Are there some specific insights that we've gotten for policy and program designing? For this study, we used qualitative research methods. In that, we went and spoke to 3 groups of people. The first category of participants was our in-depth interview respondents. These were abortion seekers aged between 18 to 35 years old. We spoke to around 17 young men and women who had an abortion before marriage. And because this is a taboo issue, it was difficult to get hold of participants and convince them to speak to us. That's why we kept a broader age limit of 18 to 35. We'd ideally like to speak to minors below 18, but that had a lot of ethical concerns. So we thought we'll take one step at a time. So among the IDI respondents, we spoke to around 10 men and 7 women. Then we also spoke to a general population of young men and women aged between 18 to 32. These were not abortion seekers, but we spoke to them to understand what they think about premarital sex, what do they think about premarital abortions, and what is the general perception around young people's sex and sexuality, right? Finally, we spoke to around 15 key informants. These were doctors, clinicians, gynecologists in private practice, a journalist, a sexual and reproductive health expert, because we wanted to understand the policy context, and we also wanted to understand what happens when young people come to seek services. In this study, and I think Jane highlighted this in her introduction, our approach has been intersectional. So we wanted to focus on gender, but along with that, we wanted to find out and explore how gender interacts with other socio-economic factors like caste, class, religion, and how do these influence young people's abortion perceptions and also their abortion pathways. So in this as I mentioned, we've used an intersectional approach to gender, and we've looked at other identities such as caste, class, and education. Before we proceed, I think it's important to point out a couple of limitations that this study has. And one is that we did purposive sampling, that is, we selected respondents keeping in mind the objective of the study, and also the fact that this is a highly taboo subject and research on this issue has been very limited. So this is a sort of a flagship study in its way. So we selected men who've had a positive role in the abortion process. Also because there was no way of reaching men who were not involved in the process. The other thing is we looked at respondents, participants from clinical settings. We were not able to get through to participants who sought out abortion from non-clinical settings, and that is a gap in the study. And finally, it was very difficult to recruit participants for this study. We took the help of a local community-based organization that has links with clinics and does community health work. They helped us identify our respondents primarily for the in-depth interviews. And these, our data, our findings is based on what the participants told us. We could not triangulate it with their partner's experience. So that's a gap. Moving on to our findings. In the findings, what we'll try to share is basically 2 major chunk of findings. One is, before we talk about male involvement, I think it's important to set the context of how premarital sex and premarital abortion are perceived and what's happening around that here. And then we'll move on to speaking about how men are involved in the process, and also what are some of the enablers and barriers in the process. So moving on to premarital sex and abortions and some of the norms and perceptions that are prevalent, one of the things that we heard while interviewing service providers, while speaking to young people in colleges, and even in our in-depth interview participants, is that they kept saying that it's very prevalent, and a lot of premarital sex is happening around us, but it's clandestine. So in a way, it is an open secret. And service providers, a lot of them attributed it to how young people in India are becoming more liberated, in quotes, as with passing time. So that's one. It's an open secret. It's prevalent. Uh, at the same time, it's considered immoral and it's highly stigmatized. It's something that is considered against our culture. Sex is acceptable only within marriage. In fact, one of our respondents, one of our participants in a focus group discussion shared that if a man truly loves his partner, he will not have sex with her before marriage. And so that is the degree of morality associated with with sex. Also in these discussions, and I think because we're talking about male involvement, we're talking about gender norms, it's very important to highlight that there are different standards for young men and young women. So while premarital sex is stigmatized, but if a young man is engaging in premarital sex, there is some sort of a bravado associated with it, and they are almost congratulated, and there's a lot of celebration of sorts amongst their peer group. But for women, it's considered an absolutely no-go zone, and it's tied to a woman's honor and the fact that a woman needs to be a virgin. She needs to be untouched until and unless she gets married. That becomes a major source of the stigma, the trauma, the fear that young unmarried women experience in the course of a premarital abortion. So, but that's what a lot of people told us. But also, as we spoke to more young people, we realized from our conversations that while they feel that premarital sex is wrong, they're also flexible about it. They accept and they shared that it's a legitimate and natural need. So we did find that they're questioning these norms, and a lot of what young people go through in their abortion journeys is based on how they negotiate these norms, perceptions around premarital sex, and also how they negotiate their own desires and this desire to break out of these norms. So this constant negotiation is what shapes their premarital abortion journeys, and is also what defines a lot of what the young men in this study describe. Moving on to male involvement and how were young men involved in the process of premarital abortions. Because we spoke to men who were supportive, who were a part of the process, we learned that they played a crucial role at each stage of the premarital abortion and pregnancy journey. Right from finding out, purchasing the pregnancy kit to confirm the pregnancy. So when we asked young men, why is it that you would go? Because we've spoken to young men and women from different socio-economic contexts, say middle income and also upper income groups. In middle income groups, a lot of them shared that their partners did not have mobility, their partners had no way of going out of the house. So that's why they went and purchased the pregnancy kit. The same cannot be said for our respondents who come from better economic backgrounds, but this notion that, oh, if a woman goes to buy a pregnancy kit, she'll be judged. There'll be this sense of unease. That's also one main reason why men went and purchased the pregnancy kits. When the pregnancy gets confirmed, men are stricken by fear, by panic, by stress, and obviously their female partner. So, but when men were talking about their sense of fear, they spoke a lot about the fear of violence against them, the fear of being accused of taking advantage of their female partner. So that was very evident. And in the cases where our respondents were in intercaste relationships, that fear was magnified. Also, as we've spoken about the stigma already, when you ask young people about their abortions, they don't talk about quality of hair, quality of care. They don't talk about whether abortion is an option. All they want to do is get rid of the situation, complete the abortion, and move on. So there is no option of not getting an abortion done. So once the pregnancy is confirmed, once the decision to have an abortion is taken, the man then becomes a major, uh, plays the major role in getting information, trying to find out where to go, what to do. And this is through his whisper network, because it's so stigmatized that men even can't speak to their own friends. So it's very carefully done. They speak to one friend, maybe someone who knows a chemist, someone who knows a doctor. So it's a whisper network because nobody is speaking about such things. Nobody is telling anyone that we're having premarital sex. Secondly, so they obviously are not talking about a situation of premarital pregnancy. So in cases where where participants had a medical abortion, usually it is the man, like when he goes to purchase the pregnancy kit, it's the man, a young man who's going and purchasing the abortion pills. And they do this by finding out maybe through a friend or by going on the internet. This is not largely based on consulting a doctor, and more so in the cases of middle income respondents. In upper income respondents, because a lot of the female participants we spoke to and also male participants, they shared that their partners had regular gynecologists, so they consulted their gynecologist. But so it's the man, and again, as I mentioned before, there is no, the woman can't go to a chemist and ask for abortion pills. In the case of a surgical abortion, men have accompanied their partner to the clinic. They found out the first and foremost difficult job is to find out which clinic to go to. And the reason why it's very difficult is because nobody really knows and it's very hidden. So for the man to be able to figure out a safe place, because a surgical abortion is an intrusive process. So young people then have this additional layer of fear because they start thinking that there's a risk to life. So that figuring out which clinic to go is a very, very difficult job for a young man to do. Once they found out the clinic, they need to ensure that it's half an hour, 45 minutes away from where their partner lives, because we must remember that everything around premarital abortions is happening secretly. So there's this layer, a blanket under which all of this is happening, and that increases the trauma and the barriers that young people face multifold. Once he's found out the clinic, he takes care of the transport, he interacts with service providers. We'll come to that a little bit more later. He pays for the service. So in some upper income cases, our respondents, our female participants paid, and he also drops his partner back home. So this, the male is playing an active role. And in upper income groups, the men we spoke to, they were confident and they shared that they went inside and they were sitting inside the clinic. But men from lower economic backgrounds, they shared that they were very afraid to go inside the clinic. So they were waiting outside. They did not want to be seen. They did not want to be accused, and they did not want to, also they felt that they might get arrested. So that's why they were waiting outside the clinic. So in terms of interactions with service providers, what's interesting is that a lot of men who said that they faced judgments by the service providers, and firstly, the service provider is not communicating to the male partner at all. They behave like the male partner is someone who sort of put the woman in such a situation. So they're sort of very accusatory. So the male is outside the circle of interaction of the service provider. And in cases that they do, they make the man feel guilty, very, very guilty. So despite the fact that the man is playing an important role, the service providers are not really interacting with the man. And this is across classes. Very limited. We found very few doctors who were open to engaging with young men. and women on these issues. We found some progressive doctors, but that was rare. After an abortion, when we spoke to men, and I think this is my favorite part because I feel that this validates the need for a study like this. So when we speak to men about their post-abortion feelings, they've shared that, I mean, nobody's really asked us how we felt and what we went through. And also, it's actually one of the first times that we're speaking about this. So men shared that they felt guilt for putting their partner through such a situation, and they also shared that they were expected to be strong. They were expected to not show their vulnerabilities at all. So I think that sort of is a key piece and it's a key takeaway, because we need to think and we need to know what young men feel also, right? And an encouraging thing that we heard when we were talking about post-abortion care is that several participants, male participants, became more careful about using condoms post the abortion in cases where the relationship continued. In terms of barriers and enablers to male involvement, a lot of it I've already spoken about, but I think in order to bring it together, I'd like to say that there is this notion that young men have, this sense of responsibility that because I'm a man, I need to make sure that everything is in control. I need to protect my partner. I need to be responsible. At the same time, that is also reinforcing women's vulnerability and the fact that, and it highlights that there's no agency then in that situation for women. So in the cases of upper income respondents who'd moved away from their home, who had financial independence, this was slightly different. In fact, one of our female upper income respondents shared that, I mean, it was great that my partner was around, but I could have managed without my partner. I mean, he was great. I got emotional support from him, but everything else I could have taken care of. But when we spoke to our respondents, female respondents from lower income communities, they said, if he was not there, if my partner was not there, I don't know what I would have done. I would have had to tell my family. I would have perhaps had to even kill myself. They also expressed this. So there is, and a lot of young men in focus group discussions, even key informant respondents, they all spoke about men as these people who need to sort of just come clean up the mess and take care of everything. Secondly, this sense of shame and stigma. And this works in both ways. One, that it's creating this sense of fear. So it's like I mentioned before, it's increasing their trouble by so much more, a lot. But at the same time, it's also driving them to give their female partner support because she has no one else to count on. So that becomes a very important driver. The stigma becomes an important driver for extending support. Though we did not speak to men who were not supportive, but in focus group discussions, a lot of young people shared that men leave. If they leave due to the fear of being accused, and also the fear that they'll have to also shoulder all the responsibility, probably be asked to marry the girl, and for which they may not be ready at that point of time. Also, as young people in relationships, these are young men who expressed a lot of love and concern for their partners. They shared that we've been in relationships for a couple of years, and there is no way that I would leave her to handle this on her own. And this sense of love, affection, we found amongst a lot of our male respondents, especially the ones who'd been in a sort of a longer relationship, a couple of years. Also, an enabler to men's involvement is the fact that because of their gender, they have certain privileges. So they have more freedom, they have more access to resources, they are more mobile, so they can go step into a chemist shop, pick up the pill, pick up the pregnancy kit, and they will face judgments maybe 2 out of 10, but for women it probably will be 11 or 12 out of 10. So because of their gender, they have that advantage. As I mentioned, service providers are not interacting with men, and the team felt that this is a highly missed opportunity, because this is where you can sort of give the young man proper information and facilitate care. Even when young men are going to buy the pills from chemists, they're not giving proper information, which is leading to incomplete consumption of the pills, which is leading to complications, and then young people have to go in for a surgical abortion. So that is a major programmatic gap, I would say, and also at the policy level. I think another barrier is lack of awareness and knowledge amongst young men, and this is because nobody is talking about these issues. Nobody knows what's happening. It's all happening, but nobody accepts it. So they do not have knowledge and awareness. They rely on their peer network. The peer network also has incomplete information. So that is a major barrier. What is interesting is that we found that a major enabler is the access to a medical abortion pill. Because medical abortion pills are available so easily, though they're supposed to be given with a prescription, but chemists just sell them, so men go get these pills, and these are very easily accessible. That actually is a major enabler right at the beginning for men to sort of play that role. So this was just sort of summarizing some of the factors that enable men and maybe act as restrictions. In summary, I'd like to say that there is this popular discourse, and that's how a lot of our interviews with service providers started, and also our focus group discussions, where there's a tendency to paint men as naturally more sexual, more exploitative, and more irresponsible. And there is sort of no layering and no desire to understand what's going on beyond that exterior. So we found that in our research. So I think we definitely need to do more and more research on issues like this. Service providers did report that they see men increasingly coming into clinics. It's definitely more in the past 5 to 6 years. And like I mentioned before, that men were like an all-in-one service provider. So their role is very important, especially given the stigma and silence. So the young unmarried woman is really relying on her male partner. The degrees vary depending upon their socioeconomic context. And finally, men's experience is like a tightrope between gendered masculinities. So they want to show that we're in control, we're going to take care, and we'll find out the information, we'll arrange the money, and we'll make sure. But at the same time, they're scared. They're scared. What has happened? How am I going to do this? I don't want to get married right now. Oh my God, I feel guilty. What have I done? I should have been so careful. And unfortunately, there's a lot of focus on the masculinities and how that is portrayed, but there is very limited focus on men's vulnerability. Finally, I'd like to end with a few recommendations. We feel that men's voices are missing. And it's very important to capture those voices, to know what they think, what they feel, and what they do, and why. And I think young men would be willing to talk. Also, because there is this whole gender dynamics, we found that a lot of premarital abortions were actually because of lack of use of contraception, were also due to a lack of consent. So these are areas that we need to work with young men, where we're talking to them about issues of consent, about gender, about equal relationships. So that's very important. And as I mentioned before, we need to speak to service providers. We need to figure out a way that service providers interact with men. And these are recommendations more specifically in terms of men, but otherwise we also heard a lot about how there is no sex education in schools. There's silence around sex. So a lot of young people said nobody's talking to them about sex. Also, nobody even thinks of them as sexual beings. So that is a major gap. We need to normalize this discourse of sexual desire and talk about young people's sexuality, sex, and what are they doing, and also how it's natural, right? And finally, the last thing that I'd like to say is that beyond all of this, we need to start to think about feminist ideas of women's dignity and honor. It is beyond a woman's virginity, it's beyond her body. And I feel that is very important because that will change and address the stigma. And the moment we do that, premarital abortions and what men do, what women do, it will become slightly easier. And there is no legal awareness around abortion in India. Abortion is a legal right, but a lot of service providers, a lot of young people we spoke to, they thought that abortion is illegal. And that also adds to their trauma and to their problems. So I'd like to end there, and a special thanks to Annie Vincent for those wonderful illustrations. Thank you.
Sapna, thank you so much for your great presentation. I also would like to echo the appreciation for the sketches illustrating your research findings. It's a really engaging way to present. We're going to turn things over now to Samuel to talk about some research in Ghana, and I think people will see some similarities as well as some differences in those findings. We're also going to allow the webinar to run a little over the 1 hour mark, Samuel, to make sure you have an opportunity to give your full presentation and in order to take a few questions. So hopefully people can hang in there with us. Samuel, I'll hand it now to you.
Thank you very much, Catherine. Let me just open the slides. Hello, I hope you all see the screen, please.
We don't. It looks to be sort of like a gray box. Is it possible to maybe close the PowerPoint and try it again and maybe open it up again?
Is it better now?
Yes, perfect.
Thank you. Sorry for that. Good. Good afternoon, good morning, and good evening to you or wherever you are. Before I do this presentation, I'd like to say a big thank you to my fellow researchers, Heather Malo, Salam Kofi Azuma, Alasan Lawal, and Elizabeth Reagan. This study is actually coming from one study that we did earlier in 2014, where we did a baseline study on our access to abortion and family planning services in various communities in the northern part of Ghana. In that was a household survey. And when we did analysis from that study, we found out that the men were having all kinds of practices, of reproductive health practices that we thought we needed to do something else to investigate and get more understanding. Hence, this study to get more understanding of men's support for family planning and abortion services. For the sake of this presentation today, I'll only be presenting on the abortion, the result from the abortion services. This was done in the northern part of Ghana, as you can see from the map in the two regions, two communities for each of the regions. And it was basically chosen because these are two communities where we have very strong traditional beliefs, especially with male dominance in household decision-making processes, including reproductive health. And we thought that certain is there to get deeper understanding of how some few men, even within this very traditional setting, were still or are still supporting their partners was quite important for us. Over and above that, we have also found that other researchers, both in Ghana and other countries, have found out that supporting men or understanding men or bringing men to this discussion is quite important in promoting or increasing access to family planning and support for abortion services in various countries. And so it was quite important that we did something like this. And our main objectives were merely to understand what motivates men to support their partners, to evaluate the type of and quality of information that men receive, and to understand how traditional and regional beliefs influence men's support of family planning and abortion services. As I said, this time I will be presenting on the abortion services. To achieve this, what we did was to use a qualitative research approach, basically using in-depth interviews, focus group discussion, and also we did what we call a community participatory method using transit work, whereby we only work in the community when we see a group of men gathered behind or under a tree or a palm tree or a mango tree, having their chat in the evening. Then we just have a chat with them over their support for abortion or family planning services, and then we did some recording from all those interactions that we had. Respondents basically were all men. For the in-depth interview, what we do was just to select or get few men who had supported their partners in assessing family planning and also abortion services. So I'll just go ahead and present some of the results that we found from this analysis. What came out strongly in all this investigation was the issue of a reason being valid. Most of the men were always talking about, for me to support my partner for abortion, the reason must be valid. And as I stated here, they think if the reasons are valid, then it's advisable, just like if the future of the woman. So they have various reasons that they call valid reason for their support for their women or their partners to have abortion services. In the next few slides, what I will do is to show you some of these valid reasons and see where these same valid reasons are also being used by others to oppose their support for family abortion services in the same community. One major reason that comes up very strongly in these traditional communities is the issue of the future of the woman. In most cases, men will say, okay, if the woman will die, then I will support her. But people hardly talk about education, trade, and all those things. So in most cases, people will say that even if the person is going to school, they will still allow the person they will still not allow the person to have the abortion, but rather have the child and continue this education later. But in this same community, we have some of the few men who are saying, okay, if for the sake of the future of the woman, I will support her to have the abortion services so that she can concentrate on her studies, on her trade, or whatever she's doing, so that the future that she is seeking, she can achieve it. Another reason, a valid reason that they cite is about issue of children. And for me, this is quite interesting because anytime you talk about abortion, other people think or say is that if you do this, you may not be able to have children in the future. And so that becomes a major reason for many men not to support their partners for abortion services. But in the same community, we have few who are using the same reason to support their partners. And I would like to read this one because it's quite interesting to me. The benefit is that after the safe abortion process she went through, she has been able to give me 3 children. But if she hadn't done the abortion, she could have died from that complication. And that would have been a great loss to me. So that for me is quite interesting, given that this is the same reason many men are also using to oppose their partners to have abortion services. Another reason that comes up strongly is the prospect of getting a husband. Many men in most of these traditional communities will say that if you have had abortion, actually you are a murderer. And the father, you may not be able to have a child. Also, kind of erodes your chances of having a partner. But within the same community, we have people who do understand, and even for the sake of marriage, continue to support their partners in order to have the abortion so that they can have their marriage at the time that they plan to have it. So what is going on in that? In all this strong traditional communities, we have all these so-called reasons or valid reasons that people will use to support. But these valid reasons sometimes are very often overshadowed by community norms, expectations, and religious reasons. So much so that because people have a lot of value for child, the fear is that when you have abortion, your prospect of having children will be eroded away. And this, I think, is also stemming from the fact that for those who think, who do not support their partners for abortion, all that they have been seeing in their community is just unsafe abortion, and which have most often resulted in death of people in their community or resulted in some injuries to the people in their community. So those are the ones they know. The safe ones, normally they do not know. And so whenever you mention abortion, all that they think of is the unsafe abortion, which normally results in all these negative consequences. And so given the community expectation and religious reasons, they always want to oppose that. In fact, even for those who are willing to support their partners, those religious expectations, those religious reasons sometimes still linger on, and sometimes they still feel that guilt of having supported their partners to go in for abortion. So there's that kind of a struggle. But the good thing is that even within all these struggles, we still have people who are supporting their partners in the community. And for us, that is kind of a window that we can work as for programs. As was the word used earlier on in the introduction, an entry point. Because if we can find people in these communities and we can involve them to understand more what the fears are and be able to reach out to the men. And the one key thing that normally comes up in all the discussions, all the interactions we had with the participants is the issue of information flow. The men, and I think this Alvana also mentioned it earlier in her presentation, men feel left out, especially with regards to information flow as to abortion and the safe abortion that is available. The law in Ghana is quite favorable when you compare it to many African countries, but people do not know, people do not understand. And so that fear still pervades and still make them, prevent them from supporting their partners for abortion, especially the area of safe services that will not result in death, that will not result in barrenness, and all those things. Those messages are not getting to the men. And I think these are the areas that we have to concentrate on. So yeah, mine is quite a short one. In conclusion, what we can say here is that in spite of the pervasive fears that it is sin and unsafe, leading to physical injury, death, barrenness, etc., there are many in traditional communities that have marital, procreational, and general well-being reasons to support their partners for abortion. And as I said earlier, this is something that I think we should capitalize on programmatically and then get the news to the rest of the men that it is not just about unsafe, but we also have the safe services, and that they do not know. So in terms of a simple recommendation, we just have to broadcast these very valid reasons that some of the men are using to support their partners to go for abortion. Get the communities understand these valid reasons, get them appreciate the need to support their partners for safe abortion services. It is just a window, it is just an entry point that we can use to get them involved, to get them support, and to get them appreciate the need to support their partners. Thank you very much. I would like to end this with a big thank you to Society of Family Planning for funding this study, and also to NORSAC for implementing this study. Thank you very much for listening.
Super, thank you, Samuel, for that presentation. We're close to time, but I'd like to go ahead and offer a few minutes for questions. If anybody has anything they'd like to ask any of the presenters or anything they'd like to share, we encourage you to just go ahead and type in the chat box. And who support and those who don't. Is one values the life and dignity and future of the women, and one values their own reputation. This seems to call for more messaging on the dignity of women. Does anybody want to comment on that? One of the presenters want to comment about that one?
Okay, I think I will take up that. As to messaging, we haven't done very well programmatically and even in terms of the national level implementations. And this is something that I think we have to focus on, in how to craft that message that will be appreciated by the men, that will be able to, that will help them to identify themselves with whatever we are trying to bring across, especially when it comes to support for abortion services. Yeah.
Thanks, Samuel. I want to just mention that Heather Marlowe, one of your co-authors, is on the call as well. Welcome, Heather.
Oh, great.
Another participant says, thank you for the great presentations. From both presentations, it is evident that sexual education and knowledge on legal rights is lacking, especially among young people. Can you please speak to possible ways to address these issues? Sapna, I don't know if you'd like to take that one.
Yes, sure. You know, that's a difficult one, because here young people, nobody's talking to them about sex. Nobody's telling them that it's okay. So talking about legal rights is something that no one would probably take initiative for. So I feel that this is where a lot of NGOs, a lot of organizations that work in communities, like for example, the community-based organization that helped us reach young men and women for this study, they do very interesting workshops where they're talking to young men and women about their bodies. At the same time, they're talking to them about rights, right over their own bodies, and also right to be free and independent. And they also cover issues of legal rights. So I feel that a major, probably a success strategy is for NGOs and community-based organizations to do the awareness building and talk to young people about legal rights. And of course, we have to use the media, and we have to use information, communication, and technology to spread awareness about the fact that abortion is legal in a country. So I would say that, yes. Thank you.
Thank you, Sapna. We have also a question from Sruti Chandraskaran. Apologies if I've mispronounced your name. And I'm glad to see that we're using both the Q&A function and the chat box, folks. So thank you for that. Thanks for the PowerPoint. Were there any insights on the discussion around how men and women make the decision about having an abortion? And also specifically in the India study, would you be able to provide a sense of how many women were accompanied by supportive men?
Hello?
Please go ahead.
Yeah, so we spoke to around 17 participants, and except one, everybody had supportive partners. This was either a man who would go and get the abortion pills, or either a man who would accompany his partner to the abortion clinic, and also the extent of support depended on whether the male partner was cohabitating with the partner, or were they living with their parents. So then a lot of the support was over phone. But these were all cases except one where men were supportive. And as I mentioned, service providers also shared that with increasing time, they're seeing more and more men coming to the clinic, especially in the last 5 to 6 years. Did I miss the first part of the question?
I think you answered pretty well. The other question was about insights on how men and women are making the decision about having an abortion. You or Samuel could comment on that one.
I think for the Ghana situation, this community, as I mentioned earlier, men will be willing to even listen to that idea only when they appreciate the reason behind it. For them, for these communities, if that reason is not valid, as I mentioned earlier, and what they mean by that validity, if that reason is not valid, in fact, the discussion, you cannot even start a discussion at all. And that is the hard part about it. So first of all, they must appreciate and the validity of the reasoning behind the need for this abortion.
Thanks, Samuel. Jane, we have a really interesting question from Richard Zikunu from PAI. I think you would be best placed to answer this one. At what point does male involvement, especially for unmarried young people, conflict with the ultimate decision of the girl to decide?
Yeah, I was reading that one too, and I really like that question. Thank you, Richard. And Catherine, if you have anything to add as well, would love to hear from IPAS's perspective. So yeah, at what point does male involvement, especially for unmarried young people, conflict with the ultimate decision of the girl to decide? From Promundo's perspective, and sort of thinking back to the earlier slide where we were talking about the guiding principles, the underlying goal of all of this is to find out ways in which we can encourage and find really strategic entry points for men to be involved in supportive ways in abortion decision making. But above all, we always aim to center women's rights and women's choice about abortion decision making, and that it is the ultimate decision of the girl, whether married, unmarried, or what other status she may find herself in, to decide when and if she decides to seek an abortion, and to ensure those services are appropriate and that and that they're of high quality. So we believe that safe abortion with dignity is every woman's right, regardless of age. So the purpose of all of this research is really to find, again, those really supportive entry points in which we can have men involved, not only as partners, but also as visible activists for reproductive rights. I hope that answers that question. And Catherine, if you have anything to add, please do.
Yeah, I'll just echo, I think the IPAS approach is similar in that way. I recognize that we're running over, but I'm gonna mention the 3 questions that are still outstanding, and then if folks would like to jump in, that would be great. We have one from Z Congo. Have we explored the potential coercion of community on men's decision to be involved in supporting abortion? If young men know that community will not accept the case of pregnancy, he can be seeking solutions with or without the girl. So that's one question. Another from Noreen Fagan. I found it interesting that men quoted had a lack of empathy for their own situations. Asking questions. These men seemed more able to empathize with others than they were able to consider themselves in the situations. For example, the situation about school leaving in Ghana. Would you say this is true? So Samuel, that one may be well directed to you. And then from Dana Law. Hi, and thanks for the excellent presentations. Given the stigma towards sex among young and unmarried people, was there any evidence of men coercing women into having the abortions? Additionally, could you share some additional information on the Ghanaian sample? So maybe Samuel, you could take a first pass at answering among these questions, and then Sapna, you could also join in.
Okay, thank you. Yeah, the question on whether the men were more of empathizing with the women than seeing themselves in the situation. Yeah, in some instances, I think I could agree with you in that. But in most of these discussions, remember when they reach the point of agreement, is the man who is going to fund the whole services. So yes, at the beginning of the discussion, and this is usually most of these are citations that are brought are all made at the beginning of the discussions. Most of these are just discussions to help them understand, to appreciate the reasoning behind why the woman wants to have the abortion. Once that discussion is concluded, and once the man sees the validity of this, then he comes in terms of the funding and all those things. So it's not so much about empathizing, but also as maybe the discussion may tend to portray. But at the end of the day, they are all part of it, and they actually will fund the whole process in terms of the service charges. Yeah. I think that is there any other?
So Sapna, would you like to join in? Sapna, if you're answering, you might be on mute.
Hello, can you hear me?
Yes, thanks. Please go ahead.
So with regards to the question on whether there was coercion on the part of men for abortion, because these were premarital abortions that we looked at, and there was really no option of not having the abortion, there was no instant of coercion. But at the same time, an interesting thing that I wanted to mention during the presentation was that a lot of young people, while deciding to get married, the abortion done, did share that ideally they'd like to get married and try to avoid the abortion. They'd like to get married and not have the abortion. But because they were young, because they were in intercaste relationships, they could not get married. That option was not there. So that's why they decided on an abortion. But in terms of male coercion, no, we did not find anything except one case where a young woman had to abort because she was living with the partner and then the partner left her when she was pregnant. But apart from that, no, we did not find anything about coercion in the context of a premarital abortion.
Thank you, Sapna. So I think that's all the time we have for today. On behalf of ICRW, Promundo, and Ipas, I'd really like to thank everyone for your interest and engagement and participation in the session. And of course, to thank the speakers for their presentations. I think there's some really interesting food for thought here. I'll just say there was a few other thank yous in the chat box, including one from Karen Thurston. Thank you so much for this research and webinar. As a volunteer escort at an abortion clinic, I talk with many men, and this research echoes a lot of what I hear from them. That's great. Thank you, Karen. I just want to mention that we will be sharing the recorded presentation with everyone in the next day or two. That will be up on the Promundo website, as Jane said. And in addition, we're hoping to have more webinars, more opportunities to talk about and share our work with men and their role in abortion in the coming months. So we invite you to stay tuned on that. Thanks so much, everybody.
Thank you.
Thank you.